In this video by Deckplate we will be discussing foot conditions, some of the most common foot conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Most common foot conditions among veterans. If you're a veteran experiencing foot pain that interferes with normal movement and daily life, you aren't alone. In fact, due to the intense physical demands of military life, some foot conditions are more common among veterans than the general population. Flat foot, pes planus flat feet, is a common condition, also known as flat foot, in which the arches on the inside of the feet flatten when pressure is put on them. When people with flat feet stand up, the feet point outward, and the entire soles of the feet fall and touch the floor. Causes of flat foot. Flat feet is not unusual in infants and toddlers, because the foot's arch hasn't yet developed. Most people's arches develop throughout childhood, but some people never develop arches. People without arches may or may not have problems. Some children have flexible flat feet, often called flexible flatfoot, in which the arch is visible when the child is sitting or standing on tiptoes but disappears when the child stands. Most children outgrow flexible flat feet without problems. People without flat feet can also develop the condition. Arches can collapse abruptly after an injury, or the collapse can happen over years of wear and tear. Over time, the tendon that runs along the inside of the ankle and helps support the arch can get weakened or tear. As the severity increases, arthritis may develop in the foot. Diagnosis of flat foot. To view the mechanics of your feet, a healthcare provider will observe your feet from the front and back and ask you to stand on your toes. The provider will test strength in the ankles and locate the main area of your pain. The wear pattern on your shoes also may reveal information about your feet. Tests. Imaging tests that can be helpful in diagnosing the cause of foot pain may include X-rays. A simple X-ray uses a small amount of radiation to produce images of the bones and joints in the feet. It's particularly useful in evaluating alignment and detecting arthritis. CT scan. This test takes X-rays of the foot from different angles and provides much more detail than a standard X-ray. Ultrasound. Ultrasound may be used when a tendon injury is suspected. Ultrasound uses sound waves to produce detailed images of soft tissues within the body. MRI, using radio waves and a strong magnet, MRI provide excellent detail of both bone and soft tissues. Plantar fasciitis. Plantar fasciitis is one of the most common causes of heel pain. It involves inflammation of a thick band of tissue that runs across the bottom of each foot and connects the heel bone to the toes, known as the plantar fascia. Plantar fasciitis commonly causes stabbing pain that often occurs with your first steps in the morning. As you get up and move, the pain normally decreases, but it might return after long periods of standing or when you stand up after sitting. Causes of plantar fasciitis. The plantar fascia is a band of tissue, called fascia, that connects your heel bone to the base of your toes. It supports the arch of the foot and absorbs shock when walking. Tension and stress on the fascia can cause small tears. Repeated stretching and tearing of the fascia can irritate or inflame it, although the cause remains unclear in many cases of plantar fasciitis. Complications of plantar fasciitis. Ignoring plantar fasciitis can result in chronic heel pain that hinders your regular activities. You're likely to change your walk to try to avoid plantar fasciitis pain, which might lead to foot, knee, hip, or back problems. Diagnosis of plantar fasciitis. Plantar fasciitis is diagnosed based on your medical history and physical exam. During the exam, your healthcare professional will check for areas of tenderness in your foot. The location of your pain can help determine its cause. Imaging tests. Usually no tests are needed. Your healthcare professional might suggest an X-ray or MRI to make sure another problem, such as a stress fracture, is not causing your pain. Sometimes an X-ray shows a piece of bone sticking out from the heel bone. This is called a bone spur. In the past, these bone spurs were often blamed for heel pain and removed surgically. But many people who have bone spurs on their heels have no heel pain. Morton's neuroma. Morton's neuroma is a painful condition that affects the ball of your foot, most commonly the area between your third and fourth toes. Morton's neuroma may feel as if you are standing on a pebble in your shoe or on a fold in your sock. Morton's neuroma involves a thickening of the tissue around one of the nerves leading to your toes. This can cause a sharp, burning pain in the ball of your foot. You may have stinging, burning, or numbness in the affected toes. Causes of Morton's neuroma. Morton's neuroma seems to occur in response to irritation, pressure, or injury to one of the nerves that lead to your toes. Risk factors. Factors that appear to contribute to Morton's neuroma include high heels. Wearing high-heeled shoes or shoes that are tight or ill-fitting can Place extra pressure on your toes and the ball of your foot. Certain sports, participating in high-impact athletic activities such as jogging or running may subject your feet to repetitive trauma. Sports that feature tight shoes, such as snow skiing or rock climbing, can put pressure on your toes. Foot deformities, people who have bunions, hammer toes, high arches or flat feet are at higher risk of developing Morton's neuroma. Diagnosis of Morton's neuroma. During the exam, your doctor will press on your foot to feel for a mass or tender spot. There may also be a feeling of clicking between the bones of your foot. Imaging tests. Some imaging tests are more useful than others in the diagnosis of Morton's neuroma. X-rays. Your doctor is likely to order X-rays of your foot to rule out other causes of your pain, such as a stress fracture. Ultrasound. This technology uses sound waves to create real-time images of internal structures. Ultrasound is particularly good at revealing soft tissue abnormalities, such as neuromas. Magnetic resonance imaging, MRI using radio waves and a strong magnetic field, and MRI also is good at visualizing soft tissues. But it's an expensive test and often indicates neuromas in people who have no symptoms. Metatarsalgia. Metatarsalgia is a condition in which the ball of your foot becomes painful and inflamed. You might develop it if you participate in activities that involve running and jumping. There are other causes as well, including foot deformities and shoes that are too tight or too loose. Causes of metatarsalgia. Sometimes a single factor can lead to metatarsalgia. More often, several factors are involved, including intense training or activity. Distance runners are at risk of metatarsalgia, primarily because the front of the foot absorbs significant force when a person runs. But anyone who participates in a high-impact sport is at risk, especially if your shoes fit poorly or are worn. Certain foot shapes, a high arch can put extra pressure on the metatarsals. So can having a second toe that's longer than the big toe, which causes more weight than normal to be shifted to the second metatarsal head. Foot deformities. Wearing too small shoes or high heels can cause your foot to be misshapen. A downward curling toe, hammer toe, and swollen, painful bumps at the base of your big toes, bunions, can cause metatarsalgia. Excess weight. Because most of your body weight transfers to your forefoot when you move, extra pounds mean more pressure on your metatarsals. Losing weight might reduce or eliminate symptoms. Poorly fitting shoes, high heels, which transfer extra weight to the front of your foot, are a common cause of metatarsalgia in women. Shoes with a narrow toe box or athletic shoes that lack support and padding also can contribute to the problem. Stress fractures. Small breaks in the metatarsals or toe bones can be painful and change the way you put weight on your foot. Morton's neuroma. This non-cancerous growth of fibrous tissue around a nerve usually occurs between the third and fourth metatarsal heads. It causes symptoms that are similar to metatarsalgia and can also contribute to metatarsal stress. Complications of metatarsalgia. Left untreated, metatarsalgia might lead to pain in other parts of the same or opposite foot and pain elsewhere in the body, such as the low back or hip, due to limping, altered gait, from foot pain. Diagnosis of metatarsalgia. Various foot problems can cause symptoms similar to those of metatarsalgia. To help pinpoint the source of your pain, your doctor will examine your foot while you stand and while you sit and ask about your lifestyle and activity level. You might need an X-ray to identify or rule out a stress fracture or other foot problems. Hammer toes. A hammer toe is a deformity that causes your toe to bend or curl downward instead of pointing forward. This deformity can affect any toe on your foot. It most often affects the second or third toe. Although a hammer toe may be present at birth, it usually develops over time due to arthritis or wearing ill-fitting shoes, such as tight, pointed heels. In most cases, a hammer toe condition is treatable. Causes of hammer toe. Your toe contains two joints that allow it to bend at the middle and bottom. A hammer toe occurs when the middle joint becomes flexed or bent downward. Common causes of this include a traumatic toe injury, arthritis, an unusually high foot arch, wearing shoes that don't fit properly, tightened ligaments or tendons in the foot, pressure from a bunion, which is when your big toe points inward toward your second toe. Spinal cord or peripheral nerve damage may cause all of your toes to curl downward. Signs and symptoms. A hammer toe causes you discomfort when you walk. It can also cause you pain when you try to stretch or move the affected toe or those around it. Hammer toe symptoms may be mild or severe. Mild symptoms. A toe that bends downward. Corns or calluses. Difficulty walking. Inability to flex your foot or wiggle your toes. Claw-like toes. Severe symptoms. See your orthopedic surgeon or podiatrist right away if you develop any of these symptoms. Diagnosis of hammer toe. A doctor can usually diagnose a hammer toe during a physical exam. Imaging tests, such as X-rays, may be necessary if you've had a bone, muscle, or ligament injury in your toe. Thank you for watching our video. Please don't forget to subscribe and like our videos.